Hello, this is LaDonna Moore, and the name of the presentation is Healthcare, a Global Look for Advanced Elective. The competencies we'll be covering in this presentation: E1, can compare and contrast healthcare in the United States with other countries around the world. E2, understands and explains healthcare from individual, societal, legal, ethical, philosophical, systematic, and financial perspectives. The first country we're going to take a look at is Jamaica. Jamaica is known for its sunny weather and beautiful beaches, but let's take a look at the Caribbean island in terms of healthcare. Jamaican healthcare is free of charge for all citizens at government clinics and hospitals. Prescription drugs are free. There are private hospitals and clinics available. Those are usually reserved for those that are a bit on the wealthier side of that lives on the island. Health insurance can be purchased if you are under the age of 65. Needless to say, the majority of the residents participate in no insurance, and they go to the Jamaican government-owned clinics and hospitals. Patients do complain that there are long lines at the clinics and the hospitals. Residents also complain that there's inadequate health care at the public hospitals. There was a columnist, Apollonia Reed, for the Jamaican Observer, wrote an article saying that Jamaican hospitals are death traps. She cites incidences where there's several patients that are left in the hallways untreated. She even cites an incident where her mom was taken there for treatment, left in the hallway for 3 days, and simply sent home without any care at all. This appears to be a common practice, a complaint rather, with a lot of the residents in Jamaica with the free hospitals. However, ironically, there is a $1 billion facility that is currently being built in Montego Bay, Jamaica, that's geared toward tourism. Tourism is one of the highest commerce for Jamaica, especially in Montego Bay. That's how they make their money. If there's no tourists, the economy is not flowing. And in order for the country to attract more tourists, they want to make sure that their healthcare is a par for tourists. So they've partnered with another company, the government has, and they're building this $1 billion facility. I find that that's a bit terrible for the residents of Jamaica who would never be able to afford being treated at this clinic. And again, let's look at the finances. Jamaica spends 4% of its GDP on healthcare. Let's take a look at one of my favorite places, United Arab Emirates. And the United Arab Emirates, it boosts itself on having world-class healthcare. The healthcare is regulated at both levels, the federal level and the emirate levels. The emirate is considered like cities, like states rather, and they have a government-funded healthcare system with the private sector. Coverage is different for each emirate. For example, the residents of Abu Dhabi, they're covered by a new comprehensive health insurance program where the costs are shared between employers and employees. Dubai, which is another emirate, residents are covered by health insurance, and that's tied to the renewal of their United Arab Emirates visas. This is also a place that's becoming a destination for tourist healthcare because of the cost. So a lot of people are coming from other countries to get procedures done as a result of the cost of the healthcare there being a little less expensive than some of its neighboring countries. The World Health Organization has said that there are a third of adults in the United Arab Emirates that are obese, and 1 out of 5 live with diabetes. So as a result of these instances and these lifestyle diseases, they have vowed to have greater quality of health care. So they're focusing on developing a healthcare infrastructure to deal with this demand. And 6% of GDP is spent on healthcare. Total expenditure on healthcare per capita is 2405. Um, the next country that we're going to take a look at is Germany. And we'll take a look and see what the Germans do regarding healthcare. Germany has the world's oldest healthcare program, oldest universal healthcare program, and 85% of it is covered by social policy, 10% by private insurance. Soldiers and police officers are covered under the special programs, and basically workers pay a health contribution that's based on their salary. The quality of healthcare is good, and you can only have private health insurance if you have a higher income. 11.3 GDP is spent on healthcare, and the total expenditure on healthcare per capita is 5182. And now let's go and take a look at Iceland. Iceland has a universal healthcare system where all citizens are covered, and there's no cost to the citizens, and this is funded by taxes and special assessments. There is no private sector of healthcare in Iceland at all. Medications, some of them are free, and for others there is a small fee. 8.9 GDP is spent on healthcare, and the total expenditure on healthcare per capita is 3882. The next country we're going to take a look at is Malaysia. Malaysia is one of my all-time favorite places to visit, and they are booming now with this tourism healthcare. They are going after the market for people who want to have procedures and want to travel. And the economy is doing well due to the tourism, and it is because of the medical tourism that's boosting the economy, and it's become a medical tourism destination. And that's because the prices for treatments are cheaper. They have clean, excellent hospitals. The doctors are highly trained, and the care is affordable. And the majority of the hospital workers are Western trained and can speak English. So that does make it a pretty hot destination for medical tourism. Foreign workers must have insurance. The public health care is subsidized by the government. 4.2 GDP is spent on health care, and 1,040 GDP expenditures is what's being done in Malaysia. Well, we've taken a look at the healthcare and the differences in healthcare around the world. And we can see that different governments, they have come up with different things for their particular countries. Um, the public and the private sector seems to work well in some situations. What we're going to do now is we're going to take a look at the second competency. Understands and can explain healthcare from individual, societal, legal, ethical, philosophical, systematic, and financial perspectives. Some of that has been covered in the previous part of our presentation. But in order to wrap it up, especially with the controversy on the Affordable Care Act, I want to talk a little bit about what I would devise for healthcare in a perfect world, and I'll call it LaDonna Care. One of my criticisms with the Affordable Care Act is when it was introduced, I don't know if it was the media, but everyone began calling it Obamacare, and I don't think that it was titled correctly. It should be titled the Affordable Care Act, which is exactly what it is. I don't think it should be named or labeled to anyone. The revisions in the act and what they're doing now, I have heard some media refer to that as Trump Care. And again, it should be labeled as whatever it is. However, this is LaDonna Care. And with LaDonna Care, there's a two-tiered healthcare system, public and private. There's no fee for citizens that are unemployed, underemployed, seniors, or disabled. And one of the big things with LaDonna Care is large corporations will be required to pay into health care for employees. We have multi-billion dollar corporations in America, and the majority of their employees, whether part-time or full-time, are receiving a lot of public benefits, and that should not be so. Walmart should not profit billions of dollars, and 63% of their employees are receiving food stamps and Medicaid. So in LaDonna Care, large corporations would be required to pay into health care for the number of employees that they have, and those corporations will be identified by the number of employees that they have in America and by the profit that they're making here. Another thing in LaDonna Care is everybody will have mental illness treatment accessible to them. A lot of insurance companies don't provide enough for the mentally ill. They don't make it easy for patients to find places to go for mental illness, and I believe that that's extremely important. What a lot of people are thinking and wondering is, how are we going to pay for the healthcare insurance? How are we going to manage this? How are we going to make it happen? Well, what needs to happen is the insurance companies need to be regulated on the amount of profit that they're able to make. The insurance companies need to be regulated in terms of how they are advising people for care. The insurance company should never deny a person's claim for an insurance claim for a procedure that's medically necessary for them to live. So the government needs to spend more time, effort, and laws on monitoring these multi-billion dollar companies where these executives are making an exorbitant amount of money, and the people are suffering as a result of it. In addition, the hospital fees need to be regulated. We learned early in the class that in some instances, an MRI does not need to cost $6,000. And the hospital fees do need to be regulated. And until the hospital fees are regulated, the insurance companies are regulated, there's going to be difficulty in getting a great healthcare plan. So with LaDonna Care, the hospital fees are regulated. The insurance companies will be regulated, and there will be a cap on prices for all prescription drugs. Everyone that has a health challenge should be able to obtain health care without stress. And that's the goal with LaDonna Care. And if you cap prices on the prescription drugs, that will help achieve that. These companies are making extremely amounts of money. I'm an entrepreneur. I understand profit. I know that that's why they're in business, and there's nothing wrong with that. But to have the profit be so huge and the deficit with the people be such of a big difference, I don't think that that's fair, and that's why with LaDonna Care, those things will be changed. Another thing that I think is very huge is that people with pre-existing conditions will either be eligible for health coverage, or they would automatically go into the public sector of our two-tiered healthcare system with LaDonna Care. And this plan is a very good comprehensive plan that will be affordable, and all people will be able to obtain the health care that they need and that they deserve. This is a list of sources used for this presentation. I thank you very much for listening. And again, this is LaDonna Moore.